Hi there, this is Dustin Reno, nurse practitioner with Pocatello Wellness Clinic. I hope this video finds you well. Today, for our topic, we are going to touch on hormone replacement therapy. So I'm sure many of you are familiar with or have heard of hormone replacement therapy, but my first question is, what is it? What does that mean? Who's it for? And how do we do it? Okay, or better yet, how do we know we need it? Okay, so with hormone replacement therapy, basically we're doing what it says we're doing in the title. We're taking hormones that your body naturally makes or used to make and replacing them, or sometimes optimizing them. You may make it still, but it's in such small quantities that your body physiologically needs more. Hormone replacement therapy ranges everywhere from thyroid hormone to sex hormone production from the ovaries or the testes in males, and so again, it's quite a wide array of things. So what are symptoms of hormone deficiency, or how would you know you're someone that might be a candidate for replacement? The symptoms are pretty big, and there's quite a few of them, and they range everywhere from fatigue, lack of motivation, difficulty sleeping or insomnia, dry skin, hair loss, oily skin, excessive sweating, low libido, weight gain, difficulty increasing muscle mass or loss of lean mass, hot flashes or flushes, night sweats. So there's a whole bunch of different symptoms that we can be experiencing if our hormone levels are getting too low. And another one being also poor memory. So you used to be real sharp, and now all of a sudden it's hard to hold on to things. Okay. As far as age goes, most women begin to experience that hormonal dysfunction or deficiency in the early 40s, mid 40s, or in the early 50s. Most males also around the same time, in the early 30s, mid 30s, early 40s. And it could just be subtle things like memory. Memory just isn't as sharp. Or, you don't have that drive you used to. Or again, maybe you're putting on some weight and you're trying everything you can, and just no matter what you do, it seems like the weight loss isn't happening. So what are some consequences of having abnormally low or suboptimal levels of hormones? Again, these are kind of a huge variety as well. They include everything from heart disease, osteoporosis, dementia, cancer, high cholesterol, insulin resistance. How do we measure our hormones? So if you're concerned you may have low levels, what do? Well, they can be done with blood work. There are options as well to test with saliva, but for insurance coverage, most clinicians will use serum or blood work to assess those hormone levels. So again, how do you know if you're a candidate? Well, if you're having the symptoms, or you've had the testing done and you've showed that your levels are low, or you've had a surgically menopause, a surgically induced menopause, like a hysterectomy, even if it is partial and they leave the ovaries, or you've had some trauma, and secondary to that trauma, there's been damage to your thyroid or head trauma that will affect how your brain or your pituitary gland is speaking to those sex organs. All of those things combined, or one or two of them, make you a candidate for testing. The benefits of hormone replacement therapy are huge. Increased energy, increased stamina, sleeping better, feeling better about who you are, just overall wellness, more motivation, increased skeletal lean muscle mass, sleeping better, better libido, loss of body fat, and improvement to your mood. Okay, that's huge, as well as the avoidance of the long-term disadvantages or negative outcomes of hormonal deficiency that we spoke of earlier, such as your dementias, heart disease, osteoporosis. If you're interested in learning more about hormone replacement therapy, or if you're a candidate, I would highly recommend you reach out to myself. Again, Dustin Reno at Pocatello Wellness Clinic, or Velma Seabolt at Wellness Associates. I can be reached at 208 203-0783. Velma can be reached at 208-271-4450. Thanks, guys. Have a great day.